As we finish 2015 and look forward to 2016, we reflect back on some of the major milestones from last year. We moved into our new mental health building at Parkwood Institute. We opened our wonderful historic chapel, refurbished back to its original glory. We also completed the redevelopment of St. Joseph's Hospital, finishing 17 years of restructuring in the city. We are proud of what we've accomplished through that time. As we look into the fall, we will be redeveloping our Palliative Care Unit. We're excited at what the new changes will bring to patient care. We have had patients and families involved in designing that unit that will be much more home-like and focused on quality end-of-life care. St. Joseph's is an academic hospital organization committed to research and teaching. We are very excited that our researchers bring new models of care to the bedside and improve the care that we provide. One of the components of our strategic plan talks about creating the best practices of tomorrow, and I want to give you two examples of that. Our researchers in diabetes are part of an international study looking at putting type 2 diabetes into remission, which means that if people are initially diagnosed, they can stop the progress of the disease so that people won't live with a lifetime of diabetes. The second example I'd like to give you is more technological. We have what we call a PET MRI scanner at St. Joseph's, the first in Canada. That particular machine allows us to see not only the structure of our body, but allows us to see the function of our body. And our researchers here at St. Joseph's have created a new attachment to that machine that will allow us to look with much more detail into the function of our brains. Very exciting in the areas of mental health care, care of people living with dementia, acquired brain injury, and other conditions of the brain. As always, it seems these days hospitals in Ontario are facing budget challenges. We are heading into our 5th year with a 0% increase in our funding, although we do need to absorb all the incremental costs associated with our staffing and our drugs and our other supplies. This creates unique challenges given the fact that St. Joseph's is a multi-sited organization and has a unique role in the healthcare system. We continue to be committed to provide quality care and look for innovative ways that we can provide care within our funding envelope. In the winter season, we know that we will be facing influenza in our community. When influenza is prevalent in our community, we will be requiring our staff and physicians who are not immunized to wear a mask to protect the people that we serve. We will also be asking visitors who are not immunized to wear a mask if they are within 2 meters or approximately 6 feet of a patient. That allows us to protect our patients who are in our care. To remind you again, hand hygiene is a foundation of infection spread and control. It's important that as healthcare providers, we wash our hands regularly before we touch a patient or a patient room, but we ask visitors to do the same. We have embarked on a new strategy, really asking our patients to be part of the solution, to both wash their hands regularly and clean their hands regularly, but also to remind us, because at times healthcare providers get busy and we sometimes forget, and we've asked our patients to remind us if they haven't seen us wash our hands before we come into their care areas. I would like to wish everyone a healthy and happy 2016. We look forward to the role that we will play in providing care to both our community and our region as we create the best practices of tomorrow to serve you better. As always, we look forward to your feedback. Our vision is to earn complete confidence in the care that we provide. If we have done so, please tell us why so we can make sure we keep doing that. If we haven't, we'd also like to hear from you so that we can continue to improve the care that we provide to you and your family members. Thank you.